Let us discuss treatment principles for P syndrome. The aim of the treatment is simply to expel the pathogenic factors that have invaded the channels and eliminate the resulting local stagnation of qi and blood in the channels. The treatment of painful obstruction syndrome is a channel treatment by definition, and it only involves treating the internal organs as a secondary aim. The most obvious and notable exception to this, however, is chronic painful obstruction syndrome, which does require treatment of the internal organs too. As a general principle, since the three pathogenic factors of wind, cold, and dampness are usually all present in painful obstruction syndrome, although with the predominance of one or two, the treatment is aimed at expelling wind, scattering cold, and resolving dampness. The essential readings from Medical Masters by Lee Jong-chi says, to treat wind painful obstruction syndrome, principally expel wind, but secondarily also scatter cold and resolve dampness and also nourish blood. To extinguish wind, treat blood. If blood is harmonized, wind is automatically expelled. To treat cold painful obstruction syndrome, primarily scatter cold, but secondarily also expel wind and dry dampness, and also tonify fire. If heat moves, cold goes. Proper circulation removes pain. To treat damp painful obstruction syndrome, primarily dry dampness, but secondarily also expel wind and scatter cold, and also tonify the spleen. If the earth is strong, dampness goes. If chi is strong, there is no numbness, which is a symptom of dampness. Although the treatment of painful obstruction syndrome is based on expelling pathogenic factors, it is also important to treat the internal condition by nourishing blood, that is the liver, to expel wind, tonifying fire, that is kidney yang, to scatter cold, tonifying qi of the spleen to resolve dampness. The treatment of chronic painful obstruction syndrome, in particular, requires a more comprehensive approach. Besides expelling pathogenic factors, it is necessary to nourish blood, nourish liver and kidneys, resolve phlegm, or invigorate blood, depending on the predominant underlying condition. Professor Chu Mao Liang advocates benefiting the kidneys and strengthening the governing vessel, or tumai, to treat chronic painful obstruction syndrome. The main reason for this approach is that the penetration of external pathogenic factors that cause painful obstruction syndrome is closely dependent on the strength of the kidneys and the governing vessel. The defensive qi, which protects the body from invasion of pathogenic factors, is yang in nature and has its root in kidney yang and the governing vessel. When pathogenic factors invade the body to cause painful obstruction syndrome, they will go through the skin, the space between skin and muscles, the channels, the sinews, and the bones. The liver nourishes the sinews and the kidneys the bones. Thus, the strength of sinews and bones depends on the nourishment not only of blood and essence of the liver and kidneys, but also on the evaporation of fluids by kidney yang, which leads to the formation of synovial fluid. When liver and kidneys are weak, blood and essence are depleted. Kidney yang cannot evaporate fluids. The defensive qi is feeble, and external pathogenic factors invade the body, causing painful obstruction syndrome. Thus, benefiting the kidneys involves both nourishing liver blood and kidney essence and strengthening kidney yang and the governing vessel. Strengthening the governing vessel is necessary, as this extraordinary vessel is yang in nature. It arises from the kidneys and it spreads defensive qi all over the back along the greater yang channels. This forms the first line of defense from invasion of external pathogenic factors also, because as will be remembered, the greater yang channels open towards the exterior. Strengthening the governing vessel with acupuncture simply means reinforcing, also with moxa, points along this vessel, especially do4, do12, and do14, and opening the vessel with the points SI3 and bladder 62. A particular combination to warm yang and strengthen the governing vessel is direct moxa on RAN 4 and 214. Thank you for your attention.